You are very welcome to Next Connect Institute. In this video, I will start a series on quality assurance, which is very important in a healthcare setting. Please try to subscribe if you haven't yet subscribed. Then apart from that one, feel free to download the videos, share them. So quality assurance will be the sessions that have just begun. During this series, our objectives would include the following: defining various terms that are used in quality assurance, discussing principles of quality assurance. Then apart from that, we also ensure that we differentiate clearly between quality assurance and quality improvement. We will definitely have to state the dimensions and cost of quality, discussing the approaches that are used in quality improvement, performance assessment, then after which it's a vision that you will demonstrate knowledge and skills in monitoring and evaluation. To begin with, quality assurance is described as an internal review process. Now, being internal means that this is being done in an organization. This could be a hospital. This could be an organization that is offering services. So this is viewed to be an internal process that audits the quality of care that is being delivered. Then apart from this, it will also focus on analyzing the situation in terms of the qualityness of the care that is being given. If there are any deficiencies that are being identified, they are corrected. So in totality, we can say this is a process which will provide confidence over a product or a service that is being offered to a population. Then the term quality itself. So this is termed to be a degree to which health services for individuals and populations increase the likelihood of desired health outcomes. So meaning, if a service is termed to be quality, the outcome from such a service that is being delivered, it should be a desired one. Meaning, if a patient walked through your health institution, they are sick, it is a vision that at the end of their visit or the care that they have received, we need to see someone coming out healthy than they walked through that facility. So that is qualityness. Then quality improvement, which is the third term that we need to understand. This is just a management technique that is used to assess and improve internal operations. So if you were to differentiate between quality improvement and quality assurance becomes a process that is taking throughout the stages of care that is being offered. Now, quality improvement will just note the deficiencies that are being identified in the care that is being provided, then after which there will be a deliberate move to correct what has been noticed to be wrong, then after which we will see or would hope that qualityness can be retained or obtained. So that is the basic difference between quality improvement and quality assurance. Now, what could be the very brief history to quality assurance? Quality assurance was developed because there was need to improve primary health care. Now, primary health care, we understand that is care that is premised on prevention of ailments before they occur. Okay, so that's the origin of quality assurance. It was all about improving the delivery of primary health care, of PHC. The approaches to quality assurance would include, number one, quality improvement and performance improvement. We have already tackled what quality improvement is. Now, performance improvement is just also speaks to the same areas as quality improvement. But performance assessment is based on the performance of particular individuals in that organization. So it will be person-centered. This is a cycle of quality assurance. For learners, it is important that you conceptualize this. If you can replicate it in an exam, even better. So the first step to quality assurance cycle includes the planning stage. Now, this planning, which of course is being mentioned here, it's planning on the premise of ensuring that quality is sustained in all stages of care, that is healthcare delivery. So the first stage is planning. Second stage is setting standards. You need to have standards. Then thirdly, communication of those standards that you set in step 2. On the fourth step, it is monitoring. Then on the fifth step, you are identifying and prioritizing opportunities for improvement. Then apart from this, on the sixth step, you want to define the problem really. Then the seventh step, identifying who will work on the problem. The eighth step, analyze and study the problem. The ninth step is choosing and designing solutions. Then the 10th step, which is the last one, is implementation of the solution. So that's the quality assurance cycle. Now, what are the principles of quality assurance? There are basic principles of quality assurance, which are 4 in number. The first one, it is client focused, meaning whatever is being done in quality assurance, we should ensure that this is client focused. Okay, so that's the first important principle. Secondly, understanding work as processes and systems. That's the second principle. When you are conducting quality assurance, you should understand that whatever is occurring in this organization, it is understood in terms of processes and in terms of systems. Okay, so that's the second principle. The third principle is all about testing changes and emphasizing on the use of data. In short, quality assurance is not based on hearsays. It is based on the data, and therefore the process becomes so scientific. Then the fourth and the last principle for quality assurance is teamwork. This is so important. Teamwork is critical, teamwork is important. And this ensures that individuals that are conducting quality assurance, they are not working in isolation, but they have people that they are working with, because experience, expertise differs from one person to the other. So that's also very important. Measuring performance in terms of qualityness is based on 2 issues. Number one, performance that matches the specification. Secondly, meeting customer expectations. So if we are measuring quality, we should ensure that what is being done in that organization or hospital, for example, what is being offered as nursing care in that organization should match the specification. In this regard, the specifications in terms of the processes, the guidelines that have been given to a particular cadre, if it's nurses, the nursing procedures, or that it should be based on what has been specified. Secondly, the customer or the client, after receiving your care, their expectations should be met at any cost, which should be desirable. Quality improvement, it's also a process, of course, that are 7 steps. And these 7 steps are essential elements that we cannot do away with. Now, it is important to note that quality improvement is being born from quality assurance. That's why I say quality assurance, it's a longer process, which is holistic, and quality improvement just focuses on areas that have been noted not to be performing well. So that's a major difference between the two. Now, quality improvement cycle will begin from step 5. And on step 5, we are identifying the problem. Step 6, defining the problem operationally. Step 7, identifying who needs to work on the problem. Step 8, analyzing the problem. Step 9, choosing and designing solution to address the cause. Step 10, implementing the solution. Step 11, re-evaluating and monitoring. So I think this is a clear difference between the two. Quality assurance, holistic process. Quality improvement, the process that is almost at the end of quality assurance. That should be, I think, noted. Let's go through the essential elements that are required for quality healthcare provision. Number 1, we need to have individuals who have technical competence. Secondly, we need to have people that have technical performance. Now, technical performance is being spoken of in terms of standards of behavior, okay? Then apart from this, regardless of an individual, having the knowledge, the skills, the attitudes really suffice more than what they have possessed. If they can relate very well with the clients, then technical performance is attained. Apart from these two elements, we also have effectiveness, which we cannot do away with. So care provided must yield the intended results. They should be effective in nature. Then efficiency, meaning we should not have any errors, okay? Providing services in a timely manner, and of course, minimizing on wastages. Safety is another thing that cannot be compromised, okay? So both healthcare providers and clients need protection against harm in any institutions. So this is safety to the client. This is also safety to the one who is providing that care. Then apart from this one, accessibility. This is an important element which is premised on human rights. So the client have the right to health care. That is why I think in the recent past we have seen a lot of institutions being built. Reason, there is need that these services be accessible to almost everyone. Continuity in care. Care should not just end abruptly without a well-coordinated manner. Interpersonal relationships, that's another important element. With this one refers to a peaceful and friendly work environment. Now, these interpersonal relationships, they are relationships that should exist between the workmates or the health workers. And apart from this one, these are interpersonal relationships that can also create with people that are coming to access our services. Then amenities, these are just accessories that will give comfort to the staff and clients. This can, of course, include just simple things. For example, we need to have a sitting arrangement that is very comfortable. And in this era of COVID-19, it is also important that these specifications are met at any cost. So very, very important. I will go through quality assessment in the next video. Thank you so much for staying up to this minute and ensuring that you are part of this session. So watch for part 2 for quality assurance so that you're able to continue from quality assessment.